Welcome back. We're in week 3. We're going to be covering chapters 6 and 7, which are on orthopedics and cardiology. For chapter 6, you're going to want to be able to describe the medical specialty of orthopedics, understand the function of the musculoskeletal system, define orthopedic-related combining forms, prefixes, and suffixes, identify structures in treating orthopedics, build orthopedic medical terms from word parts, explain orthopedic medical terms, and use orthopedic abbreviations. So let me give you a brief introduction to orthopedics. Orthopedics is the medical specialty of the musculoskeletal system. So that includes muscles and bones. Orthopedics use medical, surgical, and physical means to improve function of bones, joints, and muscles. Birth defects, traumas, infections, tumors, inflammatory conditions, and muscular problems are all treated by orthopedists. The musculoskeletal system is composed of bones, muscles, and joints. Bones are joined by ligaments to form the skeleton, and the skeleton is the framework of the body. Two bones are going to meet at a joint. Joints provide flexibility so that we can have movement. Muscles are attached to bone by what are called tendons, and these contract to move bones at the joints. On the next couple of slides, we're going to learn about some orthopedic combining terms. What I want you to do while you're listening to this is to go to figure 6.2 that shows the skeleton. In the third edition, this will be page 76. And as you're listening to how I pronounce those terms, I want you to find those on that model of the skeleton. So here are some orthopedic combining forms. Arthro, joint, burso, bursa, carpo, carpus, chondro, cartilage, claviculo, clavicle, coccygeal, coccyx, costo, rib, cranio, skull, femoral refers to femur. Fibulo refers to fibula, humero, humerus, ilio refers to ilium, ischio refers to ischium, kypho, hump, lordo, bent backwards, mandibulo, mandible, maxillo refers to the maxilla, metacarpo refers to the metacarpus. Metatarso refers to metatarsus, musculo or myo refers to muscle, myelo refers to bone marrow, osteo, bone, patello refers to patella, phalango, phalanges, pubo refers to the pubis, radio, radius, sacro refers to the sacrum, scapula refers to the scapula, scolio would mean crooked or bent, spondylo refers to vertebra, sterno, sternum, tarso, tarsus, tendino or tenno refers to tendons, tibia refers to the bone called the tibia, ulno, ulna, and vertebra refers to vertebra. Here are a few other combining forms that you should know while studying this chapter. Cutaneo refers to skin, electro refers to electricity, fibro means fibrous, ortho means straight, and patho refers to disease. We'll review a few suffixes here. Some you already know, and we keep reviewing them because they're important to know. Ac refers to pertaining to, al, also pertaining to. Algia, pain, ar, pertaining to, ari, pertaining to. Asthenia, weakness. Synthesis, a puncture to withdraw fluid. Plasia is a surgical breaking. Site refers to cell. Discis is surgical fusion. Dynia refers to pain. Eel, pertaining to. Ectomy, surgical removal. Genic, producing. Gram is a record. Graphy is a process of recording. Ick, pertaining to, and itis is inflammation. A few more suffixes. Kinesia, movement. Malacia, abnormal softening. Metry, process of measuring. Oma is a tumor. Osis, abnormal condition. Otomy, cutting into. Us, pertaining to. Pathy, disease. Plasty, surgical repair. Porosis, porous. Raphy, suture. Rhexis, rupture. Scope, instrument for viewing. Scopy, process of visually examining. Tome, an instrument for cutting, and trophy refers to development. Let's review a few prefixes as well. A, without, Brady, slow. Dis means painful or difficult. Hyper means excessive. Inter is between, intra, within. Per is through. Sub means under, and supra means above. In orthopedics, we are going to commonly treat joints, bones, and muscles. A joint is formed where two or more bones meet, and you should know that there are three types of joints in the body, and each allows for a different type of movement between the bones. Here are the three different types of joints: fibrous, cartilaginous, and synovial. An example of a fibrous joint is in skull structures, and the bones are united by fibrous tissue, and really you're not going to get hardly any movement with these types of joints. Cartilaginous joints allow for a small amount of movement, and the bones there are united by cartilage. An example here would be the pubic symphysis. The ones that we think of commonly as joints are the synovial joints. An example here is the finger joints. The bones are encased in an elastic joint capsule, and this allows for greatest range of movement, and this is going to be the most common type of joint in the body. You have four different types of bones based on their shape. Long bones are going to be longer than they are wide. An example of this would be the femur or the thigh bone. Short bones are roughly cube-shaped. An example of these would be the carpals or the wrist bones. Flat bones are going to be plate-shaped. Your shoulder blade, also called your scapula, is going to be a flat bone. And then irregular bones are unusual or have a complex shape. An example of these would be the bones that line your spinal column, called vertebrae. Bone is hard calcified connective tissue that supports the body, helps it move, and protects organs. There are two types of bone tissue. Compact or cortical bone is the dense, hard exterior surface of bones, while spongy or cancellous bone is found inside the bones and has many small spaces containing red bone marrow. There are two types of bone marrow. Red bone marrow is found in spongy bone, and this is what's going to produce blood cells. You have red blood cells and white blood cells, and that's all found in spongy bone. Yellow bone marrow is located in the shaft of the bone. So if you look at a femur, you can see that long shaft, and inside that you have yellow bone marrow, and that is made of adipose tissue. What is adipose tissue? Fat cells. Contraction of your muscle is what's going to produce movement. Your muscles are going to allow for movement of your bones. The particular type of muscle that allows for movement of your bones is skeletal muscle. And this is voluntary, so you think about it when you flex your biceps or move your legs. Smooth muscle produces movement in organs, and this is considered involuntary. You don't think about it when your stomach moves or your intestines move things. And then finally, cardiac muscle produces movement in the heart, and this is also involuntary because your heart just keeps on beating whether you think about it or not. All right, let's build orthopedic terms together. Open your book as we work through the orthopedic terms. You're going to look at page 77 if you're in edition 3. We'll work through a sampling of terms here. Word parts are divided with slashes in the book. Ac is the suffix that means pertaining to. You're going to build a term that means pertaining to the ilium. Iliac. Pertaining to under the ilium. Subiliac. So we get this, we're going to go a little bit faster. What I'd like you to do is try to build these terms on your own and then come back and see if you got it correct. Al is a suffix meaning pertaining to as well. You're going to build a term that means pertaining to the wrist, carpal, or pertaining to between the ribs, intercostal. Pertaining to between vertebra, intervertebral. So how did you do? Go and try and do everything between pages 77 and 85 without my help, and then come back and check and see if you did it okay. So, R is a suffix meaning pertaining to. Build a term meaning pertaining to the fibula, fibular. Let's start going a little faster. Arthro is the combining form meaning joint. Build a term meaning process of visually examining a joint. arthroscopy. Surgical fusion of a joint, arthrodesis. Record of a joint, arthrogram. Airy is also another suffix meaning pertaining to. Build a term that means pertaining to above the maxilla, supramaxillary. Burso is the combining form that means bursa. Bursa is a fluid-filled sac typically found between a tendon and a bone that enables the reduction of friction. If you're going to build a term meaning bursa inflammation, that would be bursitis. Surgical removal of a bursa, bursectomy. Chondra is the combining form that means cartilage. Build a term meaning abnormal cartilage softening, that would be chondromalacia. Cartilage tumor, chondroma. Cranio is the combining form that means skull. Build a term meaning pertaining to the skull. It's cranial, pertaining to within the skull, intracranial, surgical repair of the skull, cranioplasty. The cranium encases and protects the brain, and it includes the frontal, parietal, temporal, ethmoid, sphenoid, and occipital bones. Facial bones serve as points of attachment for muscles of facial expression and chewing, and these include the mandible, the maxilla, the zygomatic, the vomer, the palatine, the nasal, and the lacrimal bones. Can you find all of those bones on this figure? Eel is a suffix that means pertaining to. Build a term that means pertaining to the phalanges. Phalangeal. What are the phalanges? They're your fingers and your toe bones. Ick is a suffix meaning pertaining to as well. Build a term meaning pertaining to above the pubis. Suprapubic. Kinesia is a suffix meaning movement. Build a term meaning slow movement. Bradykinesia. Difficult movement. Dyskinesia. Excessive movement. Hyperkinesia. Muscular is a combining form meaning muscle. Build a term meaning pertaining to within muscle. Intramuscular. Myelo is the combining form meaning bone marrow. Build a term meaning bone marrow tumor. Myeloma. Producing bone marrow. Myelogenic. Myo is another combining form meaning muscle. Build a term meaning muscle pain. Myalgia. Muscle weakness. Myasthenia. Record of muscle electricity, electromyogram. Osteo is the combining form that means bone. Build a term meaning bone cell. Osteocyte, bone and cartilage tumor. Osteochondroma. Spondylo is the combining form that means vertebra. Build a term that means abnormal condition of a vertebra. Spondylosis. Teno is a combining form meaning tendon. Build a term meaning to suture a tendon. Tenorrhaphy. Tendino is another combining form that means tendon. To build a term that means abnormal condition of a tendon, it would be tendinosis. So, how did you do? Again, remember that the best way to learn this material is to try it on your own and then come back to the video to see how you did. Let's review some orthopedic vocabulary. A bone graft is a surgical procedure that uses a piece of bone to replace lost bone or fuse two bones together. A bone scan is a type of nuclear medicine that scans using radioactive dye to visualize bones. It's especially useful for finding stress fractures and bone cancer. A bunion is an inflammation and enlargement of bursa of the first metatarsal phalangeal joint. So this is the joint, or this is the joint at the base of the big toe. Carpal tunnel syndrome is a repetitive motion disorder caused by pressure on tendons and nerves as they pass through the carpal tunnel of the wrist. And you can see the carpal tunnel here on the picture on the right. A closed fracture is a broken bone with no opening or skin wound. So A would be a closed fracture. This is also called a simple fracture, whereas B is not. A comminuted fracture is a bone break in which the bone shatters into many small fragments. A compound fracture is a bone that's broken with an open skin wound, what you would see in B here. It's also called an open fracture. A compression fracture is a bone break causing a loss of height of a vertebral body. So may result from a trauma, but in older adults, it may occur in a bone weakened by osteoporosis. What we're talking about here is compression of the spinal cord. Contracture is the abnormal shortening of muscle fibers, tendons, or connective tissue, making it difficult to stretch muscle. Creatine kinase is a muscle enzyme found in skeletal and cardiac muscle. What's interesting is that elevated blood levels are associated with a heart attack, muscular dystrophy, and other skeletal muscle pathologies. One of my student researchers in my lab actually researched creatine and creatine kinase. Deep tendon reflex is an involuntary muscle contraction that occurs in response to striking the muscle tendon with a reflex hammer, a test that's used to determine whether muscles respond properly. And you've probably had the reflex checked in your doctor's office whenever you've done a physical. A dislocation occurs when bones in a joint are displaced from normal alignment and the ends of the bones are no longer in contact with each other. Figure 614 here illustrates A, a normal shoulder joint alignment, B, anterior or forward dislocation of the humerus, and C, posterior or backward dislocation of the humerus. Dual X-ray absorptiometry, also called DEXA, is a test using low-dose X-ray beams to measure bone density, and this is used to diagnose osteoporosis. Fibromyalgia is a chronic condition with widespread aching and pain in the muscles and fibrous soft tissue. Fixation is a procedure used to stabilize a fractured bone while it heals. External fixation includes casts, splints, and pins inserted through the skin. Internal fixation includes pins, plates, rods, screws, and wires that are put into place during a surgical procedure called open reduction. Fracture can be abbreviated FX, and this is a broken bone. Ganglion cyst is the formation of a cyst in the sheath covering a tendon. This is going to be frequently seen on the hand, wrist, or ankle. Gout is a type of arthritis that consists of pain and swelling at a joint, most often between the toe and forefoot. And this is caused by the body depositing crystals of uric acid, which is a metabolic waste product that occurs in soft tissues. And this is going to be more common in men. A green stick fracture is a fracture with an incomplete break. One side of the bone breaks, and then the other side only bends. And this is more commonly seen in children because their bones are still very pliable. Herniated nucleus pulposus. This is the protrusion of the intervertebral disc that occurs between two vertebrae, which puts pressure on spinal nerves. You might also have heard it referred to as a herniated disc or a ruptured disc, and sometimes this requires surgery. An impacted fracture is a fracture in which one bone fragment is pushed into another. Kyphosis is the abnormal increase in normal outward curvature of the thoracic spine, also called hunchback or humpback. So if you see here on the right, that outward curvature at the top, that would be kyphosis. Lordosis is the abnormal increase in normal curvature of the lumbar spine, also called swayback. So the middle image here, you can see her lower spine is curved forward. That is lordosis. Magnetic resonance imaging is a diagnostic imaging technique that uses electromagnetic energy to produce an image. This is especially useful for viewing soft tissues such as the spinal cord and intervertebral discs that you see here on the right. Muscle atrophy is a loss of muscle bulk due to muscle disease, a nervous system disease, or lack of use. This is also called muscle wasting. Muscular dystrophy is one of a group of inherited diseases involving progressive muscle degeneration, weakness, and atrophy, and it can be abbreviated MD. Non-steroidal anti-inflammatory drugs can be abbreviated as NSAIDs. These are a large group of drugs that provide mild pain relief and anti-inflammatory benefits for such conditions as arthritis. Some common NSAIDs are ibuprofen, also called Advil, and aspirin. An oblique fracture is a bone break where the fracture line runs along an angle to the shaft of the bone. Orthosis is an externally applied brace or a splint that prevents or corrects deformities. An orthotist is a person skilled in making and adjusting orthoses. Osteoarthritis, also abbreviated OA, is caused by the loss of cartilage cushioning covering bones in a joint. This is most commonly seen in weight-bearing joints, and it results in bone rubbing against bone. For example, this can occur in the knees. Osteoporosis is a condition that develops due to a decrease in bone mass. This results in a thinning and weakening of the bones, and it may lead to pathologic fractures. This is more commonly seen in older women. Osteogenic sarcoma is the most common type of bone cancer. It usually begins in osteocytes, and recall from your terminology, osteocyte would be a bone cell that's found at the end of bones. This most frequently occurs in people 10 to 25 years of age. A pathologic fracture is a broken bone caused by disease or weakened bone, not by trauma, so not by falling or running into something. Percutaneous discectomy. It's a procedure in which a thin catheter tube is inserted into an intervertebral disc through the skin to suck out pieces of a herniated or ruptured disc, and it may also involve a laser used to vaporize a disc. So basically they're taking a vertebral disc out of your spine. A prosthesis is an artificial device used as a substitute for a body part that's either missing from birth or lost as a result of an accident or a disease. So for example, this could be an artificial leg. A prosthetist is a person that's trained in making prostheses. Radiography is diagnostic imaging procedure using x-rays to see internal structures of the body. This is especially used for visualizing bones and joints. A reduction is correcting a fracture or dislocation by realigning a bone. A closed reduction moves bones externally. An open reduction manipulates bones through a surgical incision. Open reduction is usually performed before internal fixation of bone fragments. A repetitive motion disorder is a group of chronic disorders with tendon, muscle, joint, and nerve damage caused by prolonged periods of pressure, vibration, or repetitive movements. If you're going to be participating in sports, you might have the chance to experience some of these at some point. Rheumatoid arthritis can also be abbreviated RA. This is a type of arthritis with swelling, stiffness, pain, and degeneration of cartilage in joints caused by chronic soft tissue inflammation. It can result in crippling deformities, and it's an autoimmune disease, means basically your body is immune or allergic to parts of your own body. A rotator cuff injury may be caused by overuse or trauma. The rotator cuff is the elastic capsule that surrounds the shoulder joint, and this is reinforced by tendons of several shoulder muscles. Because the shoulder is so loose and flexible, it's at high risk for a rotator cuff tearing. Scoliosis is the abnormal lateral curvature of the spine. So if you look here, the third and figure on the right shows scoliosis. A spasm is sudden, involuntary, strong muscle contraction, and spina bifida is a birth defect when a vertebra fails to fully form around the spinal cord, and it can range from mild to severe. If the spinal cord is damaged, this can result in paralysis. A spiral fracture is bone break in which the fracture line spirals around the shaft of the bone. This is often caused by a twisting injury and often is slower to heal than other types of fractures. A sprain is a ligament injury from overstretching but without a joint dislocation or bone fracture. A strain is damage to the muscle or tendons from overuse or overstress. A stress fracture is a slight bone break that's caused by repetitive low impact forces. This can be from running instead of a single forceful impact. Torticollis is neck spasms that are severe enough to pull the head to one side. This is commonly called wry neck or a crick in the neck. Total hip arthroplasty is the surgical reconstruction of the hip with an artificial hip joint. It's also called total hip replacement, and you can abbreviate it THA or THR. Total knee arthroplasty is the surgical reconstruction of a knee joint with an artificial knee joint. It's also called total knee replacement, so you can abbreviate it TKA or TKR. A transverse fracture is a bone break with the fracture line straight across the shaft of the bone. Okay, so let's move on to the last portion of this chapter, which is orthopedic abbreviation. AE stands for above elbow, AK above knee, BDT bone density testing, BE below elbow, BK below knee. BMD is bone mineral density. C1, C2 refers to the first cervical vertebra or the second cervical vertebra. So the vertebrae that are up near your head in your neck region are called the cervical vertebra, and you'll learn more about these in anatomy. Ca refers to calcium, and the A is lowercase a. CK, creatine kinase. CTS, carpal tunnel syndrome. DJD is degenerative joint disease, and then DTR is deep tendon reflex. DXA, dual energy X-ray absorptiometry. EMG, electromyogram. FX, fracture. HNP is a herniated nucleus pulposus or herniated disc. IM, intramuscular, so sometimes you might get an IM injection. JRA, juvenile rheumatoid arthritis, meaning you would get arthritis while you're under 18. L1, L2, these refer to the lumbar vertebra. So these are the vertebrae in the lumbar region of your spine. LE refers to the lower extremity, and then if you write LLE, this is the left lower extremity. LUE, the left upper extremity. MD stands for muscular dystrophy, MRI, magnetic resonance imaging. NSAID, NSAID, non-steroidal anti-inflammatory drug. Osteoarthritis would be abbreviated OA. ORF would be an open reduction internal fixation. Ortho refers to orthopedics. RA, rheumatoid arthritis. RLE, right lower extremity. RUE, right upper extremity. T1, T2 are going to be your thoracic vertebra. So you have cervical vertebra in your neck, thoracic vertebra next, and then lumbar vertebra after that. THA, total hip arthroplasty. THR, total hip replacement. TKA, total knee arthroplasty, and TKR, total knee replacement. And again, remember those are somewhat interchangeable. THA with THR and TKA with TKR. And then UE stands for upper extremity. That does it for Chapter 6. Remember to complete the practice and review. That's at the end of Chapter 6. And then we're going to move on to Chapter 7. Chapter 7 covers cardiology and the cardiovascular system. So your learning objectives for Chapter 7 are to describe the medical specialty of cardiology, understand the functions of the cardiovascular system, define cardiology-related combining forms, prefixes, and suffixes. Identify the organs treated in cardiology, build cardiology medical terms from word parts, explain cardiology medical terms, and also to use cardiology abbreviations. So, what is cardiology? It's the study of the cardiovascular system. It involves the diagnosis and treatment of cardiovascular diseases and conditions. Cardiologists treat coronary artery disease, congenital heart defects, myocardial infarction, and many other conditions. And cardiovascular technologists perform or assist with diagnostic and therapeutic procedures. The cardiovascular system consists of the heart and the blood vessels. The heart is a muscle tissue that pushes blood through the blood vessels. And there are 3 different types of blood vessels. Arteries carry blood away from the heart. Capillaries are the point of exchange with tissues, and veins carry blood back to the heart. Here are some cardiology combining forms. Angio refers to a type of vessel, and aorta refers to the aorta. Arterio refers to arteries. Arteriolo refers to arterioles. Athero refers to a fatty substance or a plaque. Cardio, corono, heart. Embolo, a plug. Isco, to hold back. Phlebo or phlebo, to vein. Sphygmo, pulse. Stetho, chest. Thrombo would be a clot. Valvo or valvulo, valve. Varico is a dilated vein. Vaso or vasculo refers to a blood vessel. Veno, a vein. Ventriculo refers to ventricle, and venulo refers to venules. The following list presents combining forms that are not really specific to the cardiovascular system, but are used for building and defining cardiology terms. Cutaneo, skin. Electroelectricity. Esophago, esophagus. Lipo refers to fat. Myo, muscle. Pulmono, lung. And sono, sound. Let's review the suffixes that you'll be using to build terms in this chapter. Ac, pertaining to. Al, pertaining to. Ar, pertaining to. Ari, pertaining to. Dynia, pain. Eel, pertaining to. Ectomy would be surgical removal. Emia is a blood condition. Genic, producing. Gram, a recording. Graphy, process of recording. Ia, condition. Ick, pertaining to. Ism is a state of. Itis, inflammation. Ologist is one who studies. Logi, study of. And lysis, to destroy. Here are a few more suffixes. Lytic, destruction. Manometer is an instrument to measure pressure. Megaly, enlarged. Ol, small. Oma is a tumor or mass. Os, pertaining to. Osis is an abnormal condition. Otomy, cutting into. Us, pertaining to. Pathy, disease. Plasty, surgical repair. Raphy, suture. Rhexis, rupture. Sclerosis, hardening. Scope is an instrument for viewing, and spasm, involuntary muscle contraction. Stenosis is a narrowing. Tic, pertaining to. Ul means small. We introduced these prefixes in Chapter 3, but we're reviewing them here because we'll be using them to build cardiology terms as well. A, without. Anti, against. Brady, slow. Echo, a repeated sound. Endo, within or inner. Hyper, excessive. Hypo, below or insufficient. Inter means between. Intra, within. Per, through. Peri, around. Poly, many. Tachy means fast. Trans, across. And ultra means excess. You have various different types of blood vessels. First, you should know that blood flows away from the heart through arteries, then to arterioles, and then capillaries. And then gas and nutrient exchange occurs in capillaries with the tissues of the body. Then blood is going to return to the heart via capillaries, then to venules, finally to veins, where it dumps into the heart. So let's take a closer look at these different types of blood vessels. Starting with arteries, arteries carry blood away from the heart and towards a capillary bed. The arterial wall is a thick layer of smooth muscle, and this can actually relax and contract, and that's what changes blood pressure. The lumen is the channel inside the vessel, and that's what carries the blood. Most arteries carry oxygenated blood because they're pulling blood away from the heart, but the arteries from the heart to the lungs carry deoxygenated blood because that's where it receives its oxygen. After the arteries, you have what's called arterioles, which are just smaller forms of arteries. And then you have your capillaries. Capillaries connect arterioles to venules. Groups of capillaries form capillary beds, and the capillary bed is the place where blood gives up oxygen and nutrients and takes in waste products, including carbon dioxide. The capillary walls are very thin, and this enables the exchange that occurs. Venules, which are basically a smaller form of a vein, carry blood away from the capillary bed and towards the heart. Veins have walls that are a thin layer of smooth muscle instead of the thick layer that you see in the arteries. But they also have valves that prevent backflow and pooling of blood. Most veins carry deoxygenated blood, but the veins from the lungs to the heart carry oxygenated blood. Now, let's look at the anatomy of the heart. The heart is composed of myocardium. Myocardium is muscle tissue, and this contracts to push blood through vessels. There's a thin layer of smooth endocardium that lines the heart, and this is what helps to reduce friction. In the center of the heart, you have the septum, which divides the heart into right and left sides. The right side pumps blood to the lungs, whereas the left side pumps blood to the body. So you can see it's going to work a lot harder on the left side, which is why the muscle layer on the left side is so much thicker. The heart is divided into upper and lower chambers. The atria are the upper chambers, and these are the ones that receive the blood, and the ventricles are the lower chambers, and these are the ones that pump the blood to the lungs or the rest of the body. There are 4 valves that control the flow of blood in the heart. 2 valves are located between the upper and lower chambers, and then 2 valves are located between the lower chambers and the arteries where the blood gets expelled from. Now that we've discussed cardiology and the cardiovascular system a little bit, I want you to open your book and practice building cardiology terms. This is going to begin on page 109. So pause here, work through pages 109 through 114 if you're in the 3rd edition, and then you can restart and check your work. Angio is the combining form that means vessel. Build a term that means record of a vessel. Angiogram. Vessel tumor is an angioma, and involuntary muscle spasm in a vessel is an angiospasm. Aorta is a combining form meaning aorta. Aortic means pertaining to the aorta. Aortoplasty is the surgical repair of the aorta. Arterio is the combining form meaning artery. A ruptured artery is arteriorexis, pertaining to an artery. Arteriole, small artery. Arteriole. The term that means pertaining to an arteriole is arteriolar. Athero is a combining form that means fatty substance or a plaque. The term that means hardening of a plaque is atherosclerosis. Surgical removal of a plaque is atherectomy. Atrio is the combining form that means atrium. Recall that the atrium is the upper chambers of the heart, and these receive blood returning to the heart. To build a term that means pertaining to the atrium is interatrial. Pertaining to the atrium and ventricle is atrioventricular. Cardio is the combining form that means heart. Pertaining to around the heart is pericardial. Heart pain is cardiodynia. Corono is another combining form that means heart, so coronary means pertaining to the heart. Embolo is a combining form that means plug or embolus. So what's an embolus? It's a piece broken off from a clot or a mass of fat or bacteria that floats through the blood vessel until it plugs up a small blood vessel, and it blocks blood flow. So if this occurs in a coronary artery that supplies the heart, it can lead to a heart attack. The state of having an embolus is called embolism. Isco is a combining form that means to hold back. The condition of blood being held back is called ischemia. Myocardial ischemia occurs when blood flow to the heart muscle, the myocardium, is obstructed by a partial or complete blockage of a coronary artery by a buildup of plaques, also called atherosclerosis. If the plaques rupture, you can have a heart attack, which is called a myocardial infarction. Phlebo is a combining form that means veins. To build the term that means record of a vein, it's a phlebogram. The process of recording a vein is phlebography. Sclerosis is a suffix that means hardening. It's used in the cardiovascular system to describe a blood vessel becoming hard and inflexible due to the buildup of cholesterol plaques along the vessel wall. To build a term that means hardening of an artery is arteriosclerosis. Stetho is a combining form that means chest. An instrument for listening to the chest is called a stethoscope. Thrombo is a combining form that means a blood clot, also called a thrombus, pertaining to a clot, thrombotic, inflammation of a vein with clots, thrombophlebitis, to destroy a clot, thrombolysis. Valvo is a combining form that means valve. To build a term that means small valve, you would say valvule. Valvulo is another combining form that means valve. Build a term that means inflammation of a valve, valvulitis. Varicose is a combining form that means dilated vein. A varicosity is also another term for this. To build a term that means pertaining to a varicosity would be varicose. Vaso is a combining form that means blood vessel. To build a term that means involuntary muscle contraction of a blood vessel would be vasospasm. Vasculo is another combining form that means blood vessel. To build a term that means pertaining to the heart and blood vessels would be cardiovascular. Veno is a combining form that means vein. Pertaining to within a vein is intravenous. Ventriculo is the combining form that means ventricle, and recall that the ventricles are the lower chambers of the heart that are large and muscular, and they pump blood to the lungs and other parts of the body. To build a term that means pertaining to between the ventricles would be interventricular. The interventricular septum lies between the ventricles. Venulo is the combining form that means venule, and recall that venules are really small veins that receive blood from capillaries and carry them to larger veins. To build a term that means pertaining to a venule would be venular. So, how did you do? Again, remember that the best way to learn this material is to try it on your own and then come back to the video to see how you did. So that's it for building words from word parts. Now we need to go on to learn some other cardiology vocabulary that doesn't come from those word parts. Let's start with aneurysm. It's a local widening of an artery due to a weakness in the arterial wall. And as you can see in this figure here, one of the sites that it can develop in is in the abdominal aorta, but it can also develop in the cerebral arteries as well. Angina pectoralis is severe chest pain caused by myocardial ischemia. Remember, we talked about that earlier. Ischemia is a blockage of a blood vessel. Antilipidemic is a type of medication that reduces the amount of cholesterol and lipids in the bloodstream. And then antiplatelet agent is another type of medication that inhibits the ability of platelets to clump together as to form a blood clot. The term arrhythmia means an irregular heartbeat. Auscultation refers to listening to sounds within in the body, such as the heart or the lungs, by using a stethoscope. Bacterial endocarditis is the inflammation of the inner lining of the heart, which is called the endocardium, and this is caused by bacteria. It can result in a visible accumulation of bacteria called vegetation. Beta blocker drugs are medication used to treat hypertension and angina pectoris by lowering heart rate. Blood pressure is a measurement of the pressure exerted by blood against the walls of the blood vessels. And this is going to be reported as two numbers, such as 120/80. The top number is systolic pressure, and that represents the pressure in the blood vessels when the heart is contracting. The bottom number is diastolic pressure, which represents the pressure in the blood vessels while the heart is relaxing. Systolic pressure is always higher than diastolic pressure. Bradycardia is slow heart rate, and that's usually below 60 beats per minute. Cardiac arrest is the complete stoppage of heart activity, both the electrical signals and muscle contractions. Cardiac catheterization, or heart cath, is the passage of a thin tube or catheter through the veins or arteries leading into the heart. And this is used to detect heart abnormalities, to collect cardiac blood samples, and to determine the pressure within the heart. Cardiac biomarkers are complex proteins released by the heart when the heart muscle is damaged. And these are taken by blood sample to determine the amount of heart disease or damage. The most common cardiac biomarkers are creatine kinase, or abbreviated CK, and troponin. Cardiopulmonary resuscitation, abbreviated CPR, is the combination of external compressions to the sternum or the chest and rescue breathing to maintain blood flow and air movement in and out of the lungs during a cardiac or respiratory arrest. Congenital septal defect, or CSD, is a birth defect in the wall that separates the two chambers of the heart, which allows blood to pass between those two chambers. There can also be an atrial septal defect called an ASD, or ventricular septal defect called a VSD. Congestive heart failure, abbreviated CHF, is a condition that develops when the heart muscle is not able to pump forcefully enough. And this is going to reduce blood flow to the rest of the body, resulting in weakness, dyspnea, and edema throughout the body. Coronary artery bypass graft occurs during open heart surgery, in which a blood vessel, and this is often chosen from a leg vein, is grafted to route blood around arteries that are occluded in the heart. And then coronary artery disease, also abbreviated CAD, occurs because of arteriosclerosis or atherosclerosis of coronary arteries. And what is that? That's the blockage of those blood vessels via these plaques seen here. It's also called arteriosclerotic heart disease, abbreviated ASHD. Deep vein thrombosis, or DVT, is the formation of blood clots in deep veins. This usually occurs in the legs. Sometimes the pieces of the clot may break away and form emboli. Defibrillation uses an instrument called a defibrillator to give an electrical shock to the heart for the purpose of converting an arrhythmia, so a heart that's out of normal beat, back to a normal heartbeat, also called cardioversion. Doppler ultrasonography is an imaging technique that uses ultrasound to create a moving image. This is used to evaluate blood flow through blood vessels, the movement of heart valves, and the movement of the heart muscle during a contraction. Electrocardiography is a diagnostic procedure that records electrical activity of the heart. It's used to diagnose damage to heart tissue from coronary heart disease or from a myocardial infarction. End arteriectomy is the surgical removal of the inner lining of an artery. This is in order to remove plaques. Fibrillation is the abnormal quivering or contraction of heart fibers, muscle fibers in the heart. Occurrence within the fibers of the ventricles of the heart may result in cardiac arrest and death. Emergency equipment to defibrillate or convert the heart to a normal heartbeat is necessary. A heart murmur is an abnormal heart sound, such as a soft blowing sound or a harsh click. And it may be soft and heard only with a stethoscope, or so loud that it can be heard from several feet away. And doctors listen for this to see if there's something going on that's wrong with the heart. A heart transplant is the replacement of a diseased or malfunctioning heart with a donor's heart. Heart valve prolapse is where the cusps or the heart valve flaps are too loose and fail to shut tightly, allowing blood to flow backwards, which is a process called regurgitation through the valve when the heart chambers contract. This most commonly occurs in the mitral valve, but it can also affect other valves in the heart. Heart valve stenosis is when the cusps or the flaps of the heart valve are too stiff and unable to open fully, making it difficult for blood to flow through. This condition can affect any of the valves of the heart, but it most often affects the mitral valve. The mitral valve is the valve that connects the atria and the ventricle on the left side of the heart. A Holter monitor is a portable EKG monitor worn by a patient for a period of a few hours to a few days to assess the heart and the pulse activity as the person goes through activities of daily living. This is used to assess a patient who experiences chest pain and unusual heart activity during exercise and normal activities. Hypertension, which is abbreviated HTN, is blood pressure that's above the normal range. This usually means a systolic pressure above 130 millimeters mercury is what that stands for, or diastolic pressure above 80 millimeters mercury. Hypotension is blood pressure that's lower than 90 over 60 millimeters mercury and can occur in shock, infection, cancer, anemia, or as death approaches. An implantable cardioverter defibrillator, also called an ICD, is an electrical device implanted to the chest cavity with electrodes to the heart, and this applies a shock to the heart to stop potentially life-threatening arrhythmias such as fibrillation. An infarct is an area of tissue necrosis or death that develops from ischemia. Ischemia is when blood flow is blocked to that area, and you can see a picture of that in the image on the right. Intravascular thrombolytic therapy is the treatment for clots occluding the blood vessels. Drugs such as streptokinase or tissue plasminogen activator are injected into blood vessels to chemically dissolve clots. These are commonly referred to as clot busters. A myocardial infarction is the infarct of a muscle caused by the occlusion of one or more coronary arteries. The symptoms include angina pectoris, which is the pain in the chest, and shortness of breath. It's also referred to as a heart attack. Myocardial ischemia is the loss of blood supply to the heart muscle tissue of the myocardium due to the occlusion of a coronary artery. It may cause angina pectoris or a myocardial infarction. Angina pectoris, recall, is the heart pain, and myocardial infarction is a heart attack. An occlusion is the blockage of a blood vessel or other hollow structure, and it may be caused by a thrombus, a plaque, or an embolus. A pacemaker is an electrical device that artificially stimulates contraction of the heart, and this is a treatment used for bradycardia. Recall that brady means slow, so it's a slow heartbeat. Percutaneous transluminal coronary angioplasty, PTCA. It's a method for treating coronary artery narrowing. A balloon catheter is inserted into the coronary artery and inflated to dilate a blood vessel that has narrowed. Peripheral vascular disease, PVD, is the disease of the blood vessels away from the center of the body, most typically the legs. Symptoms include pain, numbness, and impaired circulation. Sphygmomanometer is an instrument for measuring blood pressure. It's also referred to as a blood pressure cuff. A stent is a stainless steel tube placed within a blood vessel or duct to widen the lumen. It may be placed in a coronary artery to treat myocardial ischemia due to atherosclerosis. A stress test is a method for evaluating cardiovascular fitness. It can either be an exercise stress test where a patient gets on a treadmill or bicycle and EKG and oxygen levels are taken while they exercise, or if a person is unable to tolerate exercise, then a chemical stress test is performed. During this test, a drug is given that dilates blood vessels and increases heart rate and blood pressure while the person lies still. Tachycardia is abnormally fast heart rate that's greater than 100 beats per minute. Transesophageal echocardiography, TEE, is a specialized echocardiography procedure in which the patient swallows an ultrasound head in order to better visualize internal cardiac structures, especially the cardiac valves. Varicose veins are swollen and distended veins. Most often these are going to occur in the legs. Venipuncture is the puncture into the vein to withdraw blood or inject medication or fluids. All right, now let's review some cardiology abbreviations. ACG, angiocardiography. AF or AFib stands for atrial fibrillation. AS is arteriosclerosis. ASCVD is arteriosclerotic cardiovascular disease. ASD, atrial septal defect. ASHD, arteriosclerotic heart disease. AV or A-V stands for atrioventricular. BP is blood pressure. BPM is beats per minute. CABG is coronary artery bypass graft. CAD, coronary artery disease. CAT, to catheterize. CCU, coronary care unit. CHD, congestive heart disease. CHF, congestive heart failure. CK stands for creatine kinase. CP is chest pain. CPR, cardiopulmonary resuscitation. CSD, congenital septal defect. CV stands for cardiovascular. DVT, deep vein thrombosis. ECG or EKG would be an electrocardiogram, electrocardiography. Echo, echocardiogram, echocardiography. Heart cath is a cardiac catheterization procedure. HR stands for heart rate, and HTN, hypertension. ICD, implantable cardioverter defibrillator. ICU, intensive care unit. IV, intravenous. LVH, left ventricular hypertrophy. MI, myocardial infarction. MM, millimeters of mercury. MS, mitral stenosis. MVP, mitral valve prolapse. NSR, normal sinus rhythm or like a normal heart rate. Pulse, P, and PTCA, percutaneous transluminal coronary angioplasty. PVC, premature ventricular contraction. PVD, peripheral vascular disease. SA, sinoatrial. SK, streptokinase. SOB, shortness of breath. TEE, transesophageal echocardiogram. TPA, tissue plasminogen activator. VF or VFib is ventricular fibrillation. VSD, ventricular septal defect. And VT or VTAC, ventricular tachycardia. That's the end of Chapter 7. Remember to complete the practice and review. This is going to help you really understand what's going on in the chapter and sounding out words and really solidifying all those terms before you complete your homework and your quiz.